two organizations of psychiatrists here in the United States this week have come out and openly called for Robert F. Kennedy Jr. to be immediately removed as the Secretary of Health and Human Services. And you might be thinking, like, okay, you got psychiatrists, literally hundreds of psychiatrists, calling for Kennedy to be removed. Obviously, it's because he's crazy and mentally unstable, right? Well, no. In fact, they didn't bring that up. They were very professional about it, which is more than I can say about myself. If I were a mental health professional, I would be saying, this guy's crazy as a loon. His brain has been partially eaten by worms, perhaps entirely eaten. I can't verify. Get him out of office. Psychiatrists had a little more class with what they said. And specifically, they have talked about the fact that Kennedy has in fact dismantled parts of Health and Human Services that were vital to providing mental health services to regular people as well as drug addicts. And these programs were helping to reduce the number of overdose deaths that America had seen every year. Kennedy has completely dismantled one of those offices specifically dealing with drug overdoses. So here is what these groups said. As physicians committed to evidence-based care, we are alarmed by the direction of HHS under Secretary Robert F. Kennedy Jr. There's been great progress in reducing the number of overdose deaths in the country as a result of these initiatives, but the firing of staff at SAMHSA earlier this year and the health secretary's efforts to shutter the agency have hurt those efforts. And RFK Jr. is trying to eliminate the federal agency that is responsible for supporting states and localities with overdose prevention. This is exactly the opposite direction that we need to be going. They also take aim at him taking aim at psychotropic drugs, which is not only reducing the people that need these drugs but are now choosing to not take them, but also putting a stigma on them, which is further causing people to not take these medications. They specifically call out the Make America Healthy Again report, saying it specifically misrepresents the data on psychotropic medications, really ignoring the full body of the scientific literature, and it is calling for various ways to limit access to psychiatric medications, which is extremely disturbing as these are medications that are critical for many individuals with depression, anxiety, schizophrenia, ADHD, and many disorders. This misrepresentation increases stigma, spreads fear, and can keep people from reaching out for help when they need it most. The report uses these inaccurate statements as a basis for taking action to restrict access to critical services that ease suffering, restore functioning, and prevent suicide. So yes, makes total sense for these psychiatrists to say, get this guy out of office. How did Health and Human Services respond? Well, here's the statement they put out via Emily Hilliard, a spokesperson for the Federal Health Department, said, quote, Secretary Kennedy remains firmly committed to delivering on President Trump's promise to make America healthy again by dismantling the failed status quo, restoring public trust in health institutions, and ensuring the transparency, accountability, and decision-making power the American people voted for. So, platitudes that mean nothing. Vague statements. We're restoring transparency. The status quo has failed. Even though these doctors are literally pointing out that what we had in place, aka the status quo, was working. But you, Emily Hilliard, who has no medical experience as far as I know, you're like, no, here's some platitudes. Piss off people who know more than I do and more than Kennedy does. Oh, and for the record, this isn't the first group that came out this week demanding that Kennedy be removed. You also had a group of 6 former U.S. Surgeon Generals, including the one who served in Trump's first term, come out and demand that he be removed. These are Trump-appointed Jerome Adams, along with, of course, Richard Carmona, Jocelyn Elders, Vivek Murthy, Antonio Novello, and David Satcher. They said Kennedy has rejected science, misled the public, and compromised the health of Americans. They accused him of sidelining experts, gutting scientific panels, and fueling misinformation that has eroded public trust across HHS agencies, including the CDC, FDA, and NIH. Instead of combating the rapid spread of health misinformation with facts and clarity, Kennedy is amplifying it. So all of that let's restore trust bullshit platitude that Hilliard fed us, the people who know best are like, they've done the opposite. People don't trust him anymore. This guy is spreading misinformation, and it's misinformation that, of course, is helping to fuel a measles outbreak across the country. Now we've got it in South Carolina, we got it in Georgia, we got it in New York, we got it in Texas, we got it in California. The body count from Kennedy's stupidity and incompetence is going to dwarf that of every other cabinet by the time this administration is over. You can mark my words on that one. The experts are warning us. When smart people smarter than me, people smarter than you, people with degrees who do this for a living, when they're the ones telling you, this guy's going to get people killed, he needs to go immediately, you should listen to them. It's like an engineer designing a bridge. They know how to make the structure function. They know how to prevent it from falling into the ocean. And when they tell you those things, listen to them. Don't listen to the wackadoo that doesn't even know how to spell engineering. But unfortunately, that's what the country is doing right now with RFK Jr. Thanks for watching, everyone. You know, we're inching closer and closer to 1 million subscribers, and we're aiming to hit that goal before the year closes. So if you aren't subscribed to the channel, please do so, and don't forget to like, comment, and share. Thanks for joining us as we head towards this huge milestone.